Iron deficiency anemia is caused by lack of iron, and if you think you have it, the NHS warns people that you need to book a GP appointment. There are a number of warning signs and symptoms that can indicate that you have low iron, but what are these and what should you do? According to the Health Service, if you think you might have iron deficiency anemia, you should see a GP who can help you by prescribing you iron tablets or advising which iron-rich foods you can eat. What are the symptoms of iron deficiency anemia? Tiredness and lack of energy, shortness of breath, noticeable heartbeats, heart palpitations, paler than usual skin, headaches. Iron deficiency can be caused by blood loss or pregnancy. However, less common symptoms of iron deficiency anemia, that are not usually connected to pregnancy, include hearing ringing, buzzing or hissing noises inside your head, tinnitus, food tasting strange, feeling itchy, a sore tongue, hair loss, you notice more hair coming out when brushing or washing it, wanting to eat non-food items, such as paper or ice, pica, finding it hard to swallow, dysphagia, painful open sores, ulcers, in the corners of your mouth, nail changes, such as spoon-shaped nails, restless legs syndrome. Join the Daily Record WhatsApp community. Get the latest news sent straight to your messages by joining our WhatsApp community today. You will receive daily updates on breaking news as well as the top headlines across Scotland. No one will be able to see who is signed up, and no one can send messages except the Daily Record team. All you have to do is click here. If you're on mobile, select Join Community and you're in. If you're on a desktop, simply scan the QR code above with your phone and click Join Community. We also treat our community members to special offers, promotions, and adverts from us and our partners. If you don't like our community, you can check out anytime you like. To leave our community, click on the name at the top of your screen and choose Exit Group. If you're curious, you can read our privacy notice. What will happen if I see my GP? The NHS says that your GP will ask you about your lifestyle and medical history. If the reason for the anemia is not clear, they may do other tests to find out what might be causing the symptoms or refer you to a specialist for further checks. Iron deficiency anemia is the most common type of anemia. There are other types, like vitamin B12 or folate deficiency anemia, that the blood test will also check for. What is the treatment for iron deficiency anemia? Join the Daily Record's WhatsApp community here and get the latest news sent straight to your messages. Once the reason you have iron deficiency anemia has been found, your GP will recommend treatment. It depends on the individual. However, if the blood test shows your red blood cell count is low, iron tablets may be prescribed. If this is the case, you will likely need to take them for about 6 months. If you do get a prescription, the NHS warn, keep iron supplement tablets out of the reach of children. An overdose of iron in a young child can be fatal. What can I eat to help my iron deficiency anemia? If your diet is affecting your iron deficiency anemia, you can try and eat more iron-rich foods. You can try and eat more dark green leafy vegetables like watercress and curly kale, cereals and bread with extra iron in them, fortified meat, dried fruit like apricots, prunes and raisins, pulses, beans, peas and lentils. What food and drinks should I avoid? You can try eating and drinking less tea, coffee, milk and dairy foods with high levels of phytic acid, such as whole grain cereals, which can stop your body absorbing iron from other foods and tablets. The reason to avoiding these is that large amounts of these foods and drinks can make it harder for your body to absorb iron. What causes of iron deficiency anemia? Heavy periods and pregnancy are very common causes. In addition to this, bleeding in the stomach and intestines is another common cause. This can be caused by taking non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and aspirin. Stomach ulcers, inflammation of the bowel or food pipe, esophagus, piles, cancers of the bowel or stomach, but this is less common if my iron deficiency anemia is not treated. What happens? If left untreated, it can make you more at risk of illness and infection. A lack of iron affects the immune system, may increase your risk of developing complications that affect the heart or lungs, such as an abnormally fast heartbeat, tachycardia, or heart failure. Can cause a greater risk of complications before and after birth if you're pregnant. Don't miss the latest news from around Scotland and beyond. Sign up to our daily newsletter.